Okay. Welcome you all in this digestive block, and the first lecture to be like with me. I'm Dr. Faisal Mughal. I think boys must have known me, Department of Anatomy. So, inshallah, in future we'll be having face-to-face in lab timings. So let us start with this. So today's topic is we will start oral cavity as a mouth, then we will do salivary glands, then we will go further down behind the oral cavity is your pharynx, and then pharynx continue in esophagus, and esophagus down goes as stomach. So objectives which we are going to have today: describe the general organization, list component of digestive system, and then features and of the lips, tongues, and palate, which are the components of the oral cavity. And then we will describe the general features of salivary glands, then pharynx and its parts, subdivisions, and then different relations of esophagus. So let us start with this first, digestive system. Now, digestive system, you can see digestive system in medical terms, it is called as gastrointestinal system. So digestive system, gastrointestinal system, and intestinal system is called as your large and small intestine both. And along with it, we have some accessory digestive organs like livers and pancreas, and that liver and pancreas can help in our digestion. Now this picture is showing you the oral cavity starts from here, okay, through mouth. Then we have some salivary glands which helps in the mastication process, which while digestion or you chew your food, then it goes behind this area, and this area is your pharynx. And then this long digestive tube, a muscular tube, it has worked just to transmit the chewed food from oral cavity to this stomach. After stomach, we have these small intestine, and then we have large intestine, and then large intestine have different parts, and then rectum and anal canal. Accessory glands are number one. This is your first accessory gland, liver, and this is the pancreas. Gallbladder also helps in digestion. So this is a general overview of your digestive system. We will go through another slide. Start with the oral cavity. Now, oral cavity, everybody know, definitely we daily brush our teeth. So of the oral cavity. This vestibule is bordered by the lips anteriorly. Okay, you can see the lips anteriorly and the cheeks on the side. If you put a brush, you can see the lips anteriorly and cheeks on the side and lips on the interior aspect. This is your this is your vestibule. And what important structure open in this vestibule area is the salivary gland, which is called as parotid gland. The duct of the parotid gland open in this vestibule. See, this is teeth, and this area is vestibule, and this is your face fat, and this is the muscle of your cheek. So you can see this parotid gland duct opens in it. We will talk much more about this parotid when we come in the parotid gland. So you can see What we have in the oral cavity? We have the vestibule and the proper mouth cavity. And where is vestibule? It is between the lips and the teeth. This area is called vestibule. Just remember this, what is vestibule. Now the lips. What are the lips? These are the fleshy folds which surround mouth cavity. And as you come across muscular system, and definitely this will follow the digestive system block, there is a muscle which surrounds, that's muscle which surrounds, just a minute, I have not made it record. Okay, so we can see the digestive system start with the oral cavity. Oral cavity has a vestibule. Vestibule it is, because of the recording I am showing you this. This is the vestibule. Okay, now coming to the lips, and these are the fleshy folds covering the orbicularis oris muscle, and the lips present as a median vertical groove in front. Can you see this? This is called philtrum. It is called philtrum. Okay, no need to remember at details of this. And lymphatic from the central part of the lower lip drain into submental lymph node and submandibular lymph nodes. So you can see these are the parts, the upper and lower lip. This goes to the parietal lymph nodes, and this lower portion goes to the submandibular lymph nodes. We are talking about the lymphatic drainage. Now the cheeks, the cheeks are on the lateral sides of your face, and below the cheek it is a muscle called as buccinator muscle, which form the main bulk of the cheek, and parotid duct pierce this muscle buccinator to open into the vestibular mouth, the upper second molar tooth. The nerve supply of cheeks and lips, definitely it belongs to face. So the only nerve which supply the muscles of the face is the facial nerve. So remember this. Facial nerve is the nerve which supply the muscles of the facial expression. And lips, cheeks, forehead, eye blink, they all are controlled by this facial nerve. And sensory branch from the maxillary and mandibular nerve, these are the nerve of cranial nerves. Blood supply, facial artery, which is going to supply.
Doctor?
Yes.
In the previous slide,
yes,
the parotid duct says that it's open in the second upper molar.
Yes, but please make this correction. Here written third, you make it 2. Okay, second molar tooth.
Yes,
this is mistake
but in slide 6,
it's written third.
Yes.
Yes, so correct it, make it 2. Okay, all of you. Okay.
Doctor?
Yes.
I think they say, or you say in the slide, it pierces the buccinator in the third molar, or opposite to third molar. But maybe it enters to the vestibule in the second molar. I don't know.
Yes, second. Make it second. In this slide, upper second molar tooth, piercing the buccinator muscle, opens into the vestibule of the mouth in upper second molar tooth. This is the answer. Okay. Now this, I think, don't have to remember all the teeth's name. There are 32, 20 in the children, which are called deciduous milk teeth. After removing of these, everybody has gone through this process, removal of the teeth, and then finally we have 32 teeth. Not 32 in one, but in upper jaw 16 and lower jaw 16. Total we have 32. So when you have time, just go through the names of this. We have 2 incisors in upper jaw and 2 in lower jaw. Then we have canine. Then we have premolars and the molar tooths. Okay, so this is how we are going to complete this 32, 16 pair, total 32. So how these are called as permanent teeth. So how many teeth we have permanent? We have 32. Now coming to the oral cavity proper. Okay, when we open the mouth, we can see this oral cavity proper. Now oral cavity proper, what we have? We have a roof of the oral cavity. Can you see? This is called roof. This is called floor of the oral cavity, and these are the two lateral walls of the oral cavity. The roof is formed by the hard and soft palate. This is hard palate, and this is the soft area which is hanging behind. This is called as soft palate. We have the lateral wall, sorry, and floor. Floor, you can see this is tongue. This you can see it is a content of the oral cavity. But if I raise the tongue, we will find out the floor of the tongue. So floor of the tongue is made by mylohyoid muscle and this anterior 2/3 of the tongue, because tongue is lying behind also. So this anterior part is anterior 2/3 of the tongue. It is in the mouth proper, which is forming the floor. The lateral wall, what they are found? These are the dental arches. Can you see? These are the dental arches. They are forming the lateral wall, and posteriorly end by this muscle called as palatoglossus muscle, which is going towards the tongue. It starts from the palate. When you do your palate and pharynx, we come across these muscle, which form arches around the oral cavity or isthmus, where we join pharynx with the oral cavity. It communicates the vestibule behind the third molar tooth. Can you see? This is the third molar tooth. So vestibule communication with the oral cavity proper behind this. This is the vestibule. You remember I told you between the teeth and the lips. If we go through this, you can see we can communicate here between the oral cavity proper and the vestibule behind this third molar tooth. So this is how there is a communication between.
Doctor,
Yes,
can you repeat the lateral walls?
lateral walls. Now if you see lateral wall are found by these arches, teeth arches inside. If you touch your teeth with your tongue, that means you are touching your lateral walls. You are touching your lateral walls. Okay, and then this lateral wall is communicated behind with the vestibule after third molar tooth. This is third molar tooth. After that, behind you can communicate with the vestibule of your mouth. Okay, now coming to the palate. Quickly, it is there is a hard palate and there is a soft palate. Palate is the roof of your oral cavity. It is formed by palatine bone, which is in the floor of the nose, and this is called hard palate. And then there are soft muscles of the palate. These are called as soft palate. So there are two parts of the palate: hard bony palate in front and soft palate behind. We have to go quickly. So hard palate, you can see, formed by the palatine process of the maxillary bone. You will see in the skull, definitely when you do musculoskeletal system, there is a skull, and a skull, there is a maxillary bone behind your nose, and that is forming the floor of the nose, but it is forming roof of the oral cavity. It is placed horizontally placed palate of palatine bone. This is horizontal plate of the palatine bone and the maxillary bone, both combine to form the hard palate. Then behind these are the soft muscle portions. Can you see they are attached to different portion of the skull, and they are supporting the soft palate. They are supporting the soft palate. Lot of students are still joining, so I'm disturbed with this also. Now coming to the soft palate, okay, which is the movable fold. If you open your mouth in front of a mirror, you can see there is a hanging portion, and that hanging portion is called as uvula. its free posterior border in a conical projection, which is called as uvula. So you can see on the lateral side of the oral cavity, you have two arches or fold extending from upside down, and they are called as palatoglossus, from palate to the tongue, and palatopharyngeal arches loading from palate up to the pharynx or tonsils. So these are the two arches hanging down behind. In this picture, you can see this arch, one arch is this and another arch. This is anterior arch and this is posterior arch. These arches are hanging from palate to the tongue, palatoglossus, and the posterior one is going from palate to the pharynx, which is behind the oral cavity. It is called as palatopharyngeal arch. And this in the center portion hanging down, this is called as uvula. So in oral cavity, you have to remember this. Now these are the muscles of the oral cavity. These muscles are of the oral cavity. Palatoglossus, just name them. Palatopharyngeus, coming to the pharynx. One which is tensing the palate during the swallowing process. Then one which is elevating the palate, levator palati, and muscula uvuli. That means these are the muscles of the phallus. You just only remember the name. Leave all this, okay? Remember the name of these muscles. This diagram shows you the different muscles. These are the arches forming from the pharynx. We'll see later on. And here you can see the muscle which is coming from this portion is palate and going towards the uvula, and this is going towards the tongue, and the muscle which is covering this uvula, these are the soft palate muscles. Okay?
Doctor,
Yes.
can you zoom in
Which one?
full screen? Full screen if you can.
Now, okay?
Oh, okay.
Okay. So now I will, if I will see that any student is coming, so I will not admit him now because I cannot see. Okay. So let us see what else. Now this is the nerve supply, or you can see of the palate. Normally, if you put your finger inside your oral cavity and touch uvula, you will feel a reflex, and that reflex is the reflex of feeling vomiting. Anybody have tried this? If you put your finger and touch the uvula, you will be having a vomiting. So this is all due to a gag reflex, and gag reflex gag reflex sorry. So this is due to the nerve supply of your palate. All muscles of soft palate are supplied by pharyngeal nerve plexus, except one muscle, tensor palati, which is supplied by mandibular branch of trigeminal. Definitely now you have not done musculoskeletal system, so this will be much difficult for you now at that level, because in muscular system we will discuss all these muscles and all. So I think at this level we must leave this nerve supply sections, and I will try to ask Dr. Valla not to include exam in this slide. Okay, arterial supply, you can see the arteries are surrounding over this area, so they are maxillary artery, facial artery branches, and external carotid artery branches. Okay, and these all venous drainage are pharyngeal veins and pterygoid venous plexus. This is all included in your head and neck region. Okay, now this is important, tongue. We have to discuss more about this tongue. Okay, you can see this is lying over here. It is a part of the floor of the oral cavity. It is a muscular organ present in the floor, anterior to the pharynx, and its function is to just mastication. Whatever we trying to chew and eat or masticate or grind, so grind, it is called as mastication process. After mastication, saliva is mixed in the food, and then you pass it down into the pharynx, and through pharynx then it goes into esophagus. So it is functioning during the mastication, deglutition process. Also, it helps in speaking, articulation, and tasting. So tongue has these all function. The muscles of the tongue are covered by a mucous membrane, which continue with that covering to the floor of the pharynx. So here you can see this all is going to be covered by the mucous membrane, and inshallah in your histology lecture you will do all the detail of the histology of the mucous membrane of oral cavity. Now be with this, there are parts of the tongue. You know what? Parts of the tongue. We divide the tongue into two parts, and these two parts are the oral part and the pharyngeal part. The oral part, it forms the anterior two-third of the tongue. You know, if we divide the tongue into three portions, it is anterior two-third of the tongue. It differs developmentally and functionally from the pharyngeal part. Now, if musculoskeletal system has been done, you have gone through the development of the tongue as well. So this is a developmental portion. Anterior two-third develop from another part and posterior one-third develop from another part, but they combine together to form one tongue. So anterior two-third is the oral part, and pharyngeal part is the posterior one-third of the tongue, and lower part of the oral phalanx, which is just behind. Okay, the pharynx, both are separated by a V-shaped sulcus terminalis. And the apex, it is the free or tip of the tongue is a free, narrow anterior end of the tongue. So what we see, we can see there is a demarcation, inverted V shape area. I will show you the picture after this slide, which is called sulcus terminalis. And apex of the surface V, it is a foramen cecum, which is a tip, which represents upper part of the end of thyroglossal duct. During development, from this portion, your thyroid gland develops, but it has a communication with the tongue. So it is that communication is called thyroglossal duct, which vanished after thyroid completely developed. The root of the tongue. The root of the tongue, which is attached to the hyoid bone and the mandible. Root of the tongue is attached to the, that means floor of the tongue. Definitely there is a mandible bone. Your lower jaw bone is mandible bone, and there is another small bone, hyoid, in front of your neck. So the root of the tongue, through muscles, they are attached to these two bones. Between tongue and epiglottis, which is a cartilage behind the tongue, there is a fold of the mucous membrane called medial glossoepiglottic fold, on each side of which is a depression called vallicula, and on laterally called the lateral glossoepiglottic fold. This all will be clear when you see this picture after this slide. Okay, the inferior surface of the tongue, if you raise your tongue, you can see it is related to the floor of the mouth and covered by mucosa, which reflect to the floor of the mouth and the gums. What it shows? It shows there is a fold which is attaching the tongue to the floor, and that is called as lingual frenulum. The name of this is called lingual frenulum. This frenulum is the attaching area. This frenulum is attaching the tongue to the floor of the mouth. Okay, floor of the mouth. Then there are also medial lingual floor, a fold of mucous membrane connecting tongue to the mucus of the floor. In the mucosa of the floor of the mouth of the tongue, prominent fold of membrane called sublingual fold. Sublingual fold because there is underlying sublingual gland. And the median end of a sublingual gland, frenulum, the sublingual gland papilla, which is the opening of the submandibular gland ducts. So sublingual and submandibular gland ducts open in the floor of the oral cavity. Now see this tongue. This is the anterior 2/3 of the tongue, and this is the posterior 1/3 of the tongue. And this V shape is sulcus terminalis. You can see V-shaped structure between anterior 2/3 and posterior 1/3 is called sulcus terminalis. Here you can see sulcus terminalis. And in the tip of this V shape, this area is called foramen cecum. This foramen cecum is the point where thyroglossal duct appears, and from here thyroid gland develops and go down and come in front of the neck. And when it completely develops, the duct, thyroglossal duct, completely vanished out, and only this foramen cecum remains. So behind in the posterior 1/3 of tongue, you can see we have a lymphoid aggregation of the tissue, which are called a lingual tonsil. And behind, at the end, this is the epiglottis. This epiglottis is a cartilage. Okay, and this cartilage is giving attachment to the tongue through this median fold, which is called a median glossoepiglottic fold. Then there are depression on each side of median epiglottic fold, vallicula, and on the lateral side we have lateral glossoepiglottic fold. So this is how this normally this glottis is attached to or near to the tongue, and whenever you pass food, chewed food from here, it will cover the larynx, and food will go into the pharynx and then into esophagus. So remember, anterior 2/3, posterior 1/3, sulcus terminalis, foramen cecum, epiglottis, median epiglottic fold. On lateral side, this is vallicula, and here you can see lateral glossoepiglottic folds. Remember that. The muscles. Now there are some extrinsic muscles and the intrinsic muscles. Extrinsic muscle, what are extrinsic muscle? They are coming from lateral side or inferior side and attached to the tongue. They help in the movement of the tongue. As the name indicates, palatoglossus comes from palate and goes to the tongue. Hyoglossus, coming from a hyoid bone, goes to the tongue. Genoglossus, there is a tubercle in the mandible bone, coming from that tubercle goes to the tongue. Styloglossus, coming from the styloid process of the skull and goes to the tongue. These are the extrinsic muscles which retract and elevate the tongue and move it on the opposite side. Okay, the one important muscle which is called genoglossus, this is the only fan-shaped muscle which help protrude the tongue. You can take out the tongue outside the mouth. This muscle is helping in this. So remember, genoglossus, mostly the muscle which is taking out the tongue, it's called genoglossus muscle. Now here you can see these are the muscles which are supporting external. This is genoglossus tongue. Okay, this is styloglossus. This is palatoglossus. So these are the coming from above and it goes to the tongue, goes to the tongue. And this is the fan-shaped muscle, genoglossus. Okay. Now this diagram shows the nerve supply of the tongue. Let us see. Now these were the extrinsic muscle. Intrinsic muscle give the shape to the tongue, and these are the muscles which are normally lying within the shape of the tongue. They are not attached to the bone. They consist in different direction, transverse fibers, longitudinal fibers, and vertical fibers. They alter the shape of the tongue while it is lying in the mouth cavity. So intrinsic muscle give the shape of the tongue. Now mark this slide, very important. Okay, mark this slide Very, very important, because the nerve supply have motor and sensory. Motor means all muscles, movement of the tongue are supplied by hypoglossal nerve, except palatoglossal muscle, which is supplied by pharyngeal plexus. Okay, so motor supply, all muscles of the tongue, extrinsic, intrinsic muscles are supplied by hypoglossal nerve, except one muscle which is called palatoglossal, which is supplied by pharyngeal plexus. Now coming to the sensory supply. Sensory supply, that means the taste. Anterior two-thirds of the tongue. Anterior two-thirds of the tongue is supplied by lingual nerve, which carry general sensation, all sensation, temperature, pressure, or everything is through the lingual nerve. But there is another nerve, which is called chorda tympani, which is branch of a facial nerve, which carry taste sensation from anterior two-thirds. Please mark this two lines, very important. This will come in any part of your exam, either in your block exam, in your clinical exam. They will ask this also. Posterior one-third, which is behind the sulcus terminalis, it is supplied by glossopharyngeal nerve. Look at the name of them. Gloss means tongue, pharynx means pharyngeal nerve, which carry both journal as well as sensory fiber. Okay, just in anterior two-thirds, there are two nerves: lingual, journal sensation; chorda tympani, taste sensation. But posterior one-third, glossopharyngeal nerve, which carry both journal and taste sensation. Most posterior part, which is down, touching to the epiglottis, it is by the vagus nerve, which carry both journal and taste sensation. So this slide portion all comes in MCQs, in your short notes or whatever. You can go through this carefully. Okay. Now coming to this all diagrammatic way, hypoglossal nerve, which is going to supply the extrinsic muscle. And here you can see a good diagram to recall. What recall? Anterior two-thirds, lingual branch of trigeminal nerve is the total sensory, and taste, chorda tympani, facial nerve and lingual branch. Posterior, glossopharyngeal. These are the number of the 9th cranial nerve. This is the 5th cranial nerve, trigeminal part, and this is 7th facial. And the most posterior part, which is from the vagus nerve and the hypoglossal nerve. So here you can see, if you recall this diagram, you can go through your nerve supply of the tongue. Blood supply and lymphatic drainage. Lingual artery arises from external carotid artery. Name is lingual artery, supplying the blood. Lingual branches of the facial artery also supplies the blood to the tongue. Venous drainage. Two veins accompany to the dorsal lingual artery. They join to form lingual vein, which ends into internal jugular vein. And lymphatic drainage, the area submental lymph node, submandibular lymph node, and jugulo-digastric and omohyoid lymph node, all which is lying below the tongue lymph nodes, they all drain your tongue. Okay, now we have salivary glands. Salivary glands are the glands which produce saliva, and all saliva comes in oral cavity proper, and that is going to help in your mastication. So the number one, parotid gland, which is the largest gland present outside. Outside means below your cheeks, below your skin of the cheek. Okay, outside the buccinator muscle. It is the largest of the salivary gland. It lies below the auricle, your ear, occupying the region between ramus of the mandible and mastoid process. This we are talking about the bony part of the mandible. It has a capsule which covers from the deep fascia of the neck. Thick ends of the deep fascia extend from the styloid process to the angle of the mandible, which is called stylomandibular ligament. and separate the capsule from the submandibular gland. Sometimes because of these facial coverings, the swelling is very painful. And there is a disease called as mumps, in which that particular swelling can cause a very much painful condition in which the parotid gland stop its secretions. These are called as mumps. So the swelling of parotid gland are very painful. Structure within the parotid gland. Now parotid gland, as it is lying on the side of the face and in front of the ear, many structures which are supplying the face musculature, they cross from this parotid gland. What are those? Termination of the facial nerve, beginning of the 5 terminal motor branches of the facial nerve, and most superficial structure in this gland. So the termination of these nerves, whenever there is a swelling, compression of this nerve can cause painful face structures, or sometimes they can cause your paralysis or difficulty in the movement of the facial muscle expressions. Then we have termination of superficial temporal and maxillary veins. The whole retromandibular vein begins in its 2 division, anterior and posterior, within this parotid gland. So this, please make it very important, structure lying within the parotid may come short note or it may come as a MCQ. Secondly, termination of the external carotid artery also lies within the parotid gland. And the 2 terminal branches are superficial temporal and maxillary, which is the deepest structure. And deep parotid lymph node are also within this gland. So these 4 structures you have to remember that they are lying within the parotid. Here you can see the different the external carotid artery is dividing into superficial temporal artery. Here you can see the mandibular veins, anterior and posterior, retromandibular vein. Then parotid duct comes from out from here, goes, and these are the terminal branches of the facial nerve. So this is the picture showing you the different structure lying within. This is lying within. Facial nerve lying within the gland. External carotid artery lying within the parotid gland.
Sir,
Yes.
can we go back to
I think I have to complete. If you have
previous
questions,
slide?
you can ask in the end, because there is
Yes.
a lot of material. Okay.
Okay. Okay.
Now here you can see this is the parotid gland position in front of the ear and on the lateral side of this masseter muscle. You can see from the anterior margin of this parotid gland, this parotid duct is appearing, which carry the secretion of this parotid gland, mostly watery secretion. It carries and reach to the vestibule of the mouth by piercing this masseter muscle, buccinator muscle. This is buccinator, this is masseter. Okay, so here you can see this is the buccinator muscle pierced by this parotid duct, and where it penetrates the buccinator crown to the upper second molar tooth. Okay, upper second molar tooth is the area where it is draining. So this is the detail you can read later on, but you can see its termination. Okay. The oblique passage of the duct acts as a valve mechanism. It is obliquely entering. Whenever buccinator muscle acts, it closes this duct. So the saliva cannot go back in this area. Now, the nerve supply, you can read it, but I think this is more related to the physiology, that it is preganglionic, lesser petrosal nerve, it is going and branch of the, all are controlling its secretion. Just remember that all are controlling glossopharyngeal nerve and mandibular trigeminal. They are controlling its secretion. This one. Nerves of blood supply, external carotid and retromandibular vein, and superficial and deep parotid lymph nodes are draining it. Then there is another gland, submandibular. Why it is called submandibular? Because it is lying in the mandible bone, below the mandible bone, inside. So here you can see this gland is submandibular gland, and if you touch your lower jaw, this mandible bone, on the posterior or in the middle of the jaw, you can feel this gland, and this gland is submandibular gland, and the submandibular name according to its position. It is smaller than the parotid gland, superficial, and lie in the relation of mylohyoid muscle. This muscle is mylohyoid, which is forming floor of the mouth. The superficial part of the gland is directly against mandibular fossa of the mandible, inferior to the mylohyoid line. These are the feature of mandible bone. Musculoskeletal, you will come across this mandible detail. The deep part of lie within the floor of the oral cavity. That means this is the floor of the oral cavity. So superficial part is outside, deep part lying within the floor of the cavity. The submandibular duct, the only duct, it opens into the floor below the tongue, lateral side to the frenulum, which is your fold of the tongue, which is attaching to the floor of the mouth. So submandibular duct passes forward to open in the summit of the small submandibular gland, a small submandibular papilla beside the base of the frenulum of the tongue. The lingual nerve loops under the submandibular duct, and facial artery is related to its lateral surface. You can see the facial artery comes in front after crossing and goes to the face. So it is related to your particular submandibular gland. Here you can see this is submandibular gland. Sorry, this is the position of submandibular gland. On radial side, it is the mylohyoid, and here submandibular fossa. So this portion, and this is the floor of the mouth, frenulum, and it opens in this side. Now we are coming to the sublingual gland. It is on the medial side of the floor, just below the mucosa of the tongue, in the floor, lying in the sublingual fossa of the mandible. Size is smallest salivary gland of three. It is almond shaped, wide anterior and posterior, and small 8 to 20 small ducts. They directly open into the floor of the mouth on the lateral side of the frenulum. So what you have to remember, it is small, lying in the floor on the lateral side of the tongue, and opens by 8 to 20 small ducts. Now in this picture, it can show you this sublingual gland. Okay, here you can see this is the floor of the mouth, this is the tongue, inferior surface, this is the fold which is called frenulum, and on the lateral side of the tongue frenulum, this is the opening of your submandibular gland, and here sublingual gland, it has multiple opening. Here you can see this is the sublingual fold overlying the sublingual gland, and these are the two caruncles which opens for the sublingual caruncle, open for the submandibular duct, and this is the frenulum. And here you can see the small sublingual veins, they are going to drain from here. Okay, so these are the muscles, genoglossus muscle, and the floor of the muscle, hyoglossus muscle, this is hyoid bone, and here is the deep part of submandibular gland, and this is the superficial part of the submandibular gland, and this is the duct of the submandibular gland, opens towards the frenulum, and this is sublingual gland. You can see many small ducts open directly into the floor of the mouth, They are supplied by the branches of facial and lingual arteries. Now the second last part of this lecture is the pharynx. What is this? It is a muscular membranous tube situated behind the nose, oral cavity, and behind the nose. Can you see? This is nose, behind the nose. What is this? Oral cavity, behind the oral cavity. And what is this? This is larynx, which goes into trachea, windpipe. This whole portion is called pharynx. So what is? It is a musculo and mucous membrane tube. Continue below, this is esophagus. Can you see this small tube? This is continue down and it extends from, if you count from, this is the base of the skull up to the 6th cervical vertebrae. 6th cervical vertebrae. This is the extension of the pharynx. It has 3 parts. One which is behind the nose is called nasopharynx. One which is behind the oral cavity is called oropharynx. One which is behind the larynx, it is called laryngopharynx. They communicate with the nasal cavity, the oral cavity, and laryngeal inlet. What is this? This is, I told you, epiglottis, which is just behind the tongue. Epiglottis. When you pass your food from the oral cavity, this epiglottis will close this tracheal tube, larynx, and the food which slips down into this esophagus. Okay, let's move it down. There are layers in this, from inside to outside. Inner mucous membrane, which is surrounding the pharynx. Then we have submucosa. Then there is a pharyngo-basilar fascia. This epineuritis is a strong fibrous sheath over the inner surface of the muscle layers, acting as a pharyngeal framework which holds down these muscles. Then muscular layer, they are formed in 2 layers. Outer circular muscles made up of 3 constrictor muscles. And what are the 3? There are 3 constrictor muscles, superior, middle, and inferior constrictor muscles. Then there are another layer which is called longitudinal, which comes from different parts of the skull bone and goes into the pharyngeal wall. And the 3 are stylopharyngeus, come from styloid process of the base of the skull to pharynx. Salpingopharyngeal from the eustachian tube part of the skull to the pharynx, and palatopharynx from the hard palate to the pharynx. This we have discussed before in the tongue. So there are 3 constrictor muscles and 3 longitudinal muscles. They are total 6 muscles forming the pharyngeal wall. Then we have buccopharyngeal fascia, thin, delicate connective tissue covering the outer surface of the constrictor. That means one facial layer is inside and another facial layer is outside. The pharyngeal plexus of veins and nerves lies beneath this fascia. Now these are the 3 muscles: stylopharyngeus, salpingo, and palatopharyngeus. When you have time, just read from where it arises, where it goes, and what is their function. All this longitudinal muscle, they elevate the pharynx, and constrictor will contract and push the food down towards the esophagus. When you swallow, the pharynx will open the cavity. The food which is in the oral cavity goes behind, and then constrictor start to constrict and push that food into the esophageal tube. This is process of swallowing you will do in the physiology. Here you can see these are the constrictor muscles. You can see superior constrictor, then middle constrictor, and the inferior. The first one contract, it pushes the food down, then second contract, then third contract, and then the food goes inside the esophagus. So here you can see lateral view, superior constrictor, middle constrictor, and inferior constrictor. Then there are muscles which are coming from above and holding the pharynx. They are called the elevators. When they contract like this, when they contract, they elevate the pharynx. So the bolus of the food goes into the pharynx and go down into. Now here you can see in between the muscles there are some gaps. There is another gap and there is another gap. So structures are lying in between this gap, which are going towards their particular area. So here you can see palatopharyngeal muscle, salpingopharyngeal muscle, and other longitudinal muscles. Let us see that what crosses in the. There are gaps. 3 constrictors are leaving 4 gaps through which different structure pass. The first gap, which is the larger one, which is above the border of the superior constrictor, close to the pharyngobasilar fascia. What crosses from here? If you see, this is the first one. Can you see? This is above the superior constrictor and the palatopharyngobasal fascia. And these are the 2 muscles, levator tensor palatine muscle and auditory tube crossing from here. So this is the material for your MCQs, this slide. Okay, when you revise this lecture, this slide is also important, like tongue. So auditory tube, the palatine muscles and accessor palatine artery. Second gap between superior and middle constrictor. If you see, second gap is between superior and middle constrictor. You can see this stylopharyngeal muscle is crossing and glossopharyngeal nerve is crossing over here. Remember these. Third gap is between middle constrictor and inferior constrictor muscle. You can see the superior laryngeal artery and internal laryngeal nerve crossing from here. The fourth one, which is between the thyrotracheal membrane crossing, this is also a nerve going inside this cricothyroid membrane. The third gap between middle and inferior give to the superior laryngeal artery and internal laryngeal nerve. Mostly this is asked in the exam. The fourth gap, which is inferior to the inferior constrictor and esophagus, give passage to recurrent laryngeal nerve and inferior laryngeal artery. So please remember all 4 gaps and the structure crossing this. The superior, middle constrictor, inferior constrictor are propulsive muscles. During swallow, and longitudinal muscles pull the pharynx upward in the second stage of swallowing. Now, this is oropharynx we are talking about, because this will nasopharynx we will do in respiratory system. Oropharynx, you can see, this is the oral part of the pharynx. There is 2 arches we have discussed before, palatoglossus, palatopharyngeus. You can see from front palato. This is actually communication between pharynx and the oral cavity. This is oropharynx. This is a common passage for air and food also. Air from the nose goes down into the trachea and food from here goes down to the esophagus. Now during the deglutition or the swallowing process, the air passage is closed by this. Is closed by the epiglottis, supported behind by the axis and the cervical 3. This is the axis first and the third cervical vertebra. So behind these are the margins of the, and laterally palatoglossus and palatopharyngeal membrane. You can see this palatoglossus and palatopharyngeus arches are on the lateral side, and in between 2 arches you can see this is a tonsils, aggregation of the lymphoid tissue, which is called as palatine tonsils. So these are the palatine tonsils, appear commonly called simple as tonsils. Usually these tonsils get inflamed and there is a difficulty or painful swallowing when the food touches these tonsils. Okay, let us move further. Now coming to the esophagus, the last part of our, below the pharynx, laryngopharynx, we have esophagus. Now generally, what is esophagus? It is a muscular tube which just carry or transmit or allow the chewed food from oral cavity goes down to the stomach. Nothing else. It has nothing to do, just this muscular tube allow the passage of the food from oral cavity pharynx down to the stomach. And it has to cross a partition which is called diaphragm, which is the partition between thorax and abdomen. It crosses from here and continue as a dilated portion called as stomach. So it is a tubular structure, 25 centimeter long. It is flattened anterior and posteriorly because its lumen is kept collapsed. Only it dilates when the food is passed through it. It begins at the level of 6 cervical vertebra because at the above 6 is your pharynx. It begins as the continuation of the pharynx at the level of 6 cervical vertebra. Then it pierces this diaphragm at the level of 10 thoracic vertebra to join this stomach. To join, so you have to remember the level 6 cervical vertebra up to the 10 thoracic. It ends by opening into the stomach at the 11th thoracic vertebra. But when it crosses the diaphragm, it is at the 10th thoracic vertebra. It has 3 parts: cervical in the neck, thoracic when it crosses the thoracic cavity, and abdominal, a small portion which is abdomen. This is small portion is abdominal portion. Now what we have to remember this? What we have to remember, first of all, the muscular layer of the esophagus in the upper portion, it is skeletal muscle. Why? Because when we are pushing the food down from the pharynx, they all are in the voluntary control. We can push food downward. But in the middle part of the esophagus, we have both smooth muscle and few skeletal muscle. But in the lower portion of the esophagus, we have all smooth muscle. They contract by themselves. So there are constrictions. Constriction means narrowing in the esophagus. And these narrowings have some clinical importance. Why? Because if you see, these narrowing are from the external area, that means from where it starts, that means at the level of larynx, then where trachea and arch of aorta cross in front of it. This is another narrowing in the esophagus. And third narrowing when it crosses the diaphragm. So these 3 areas are making narrowing of the esophagus. The first is the junction of the pharynx and esophagus. This is the first narrowing. If anything stuck up, it is stuck at this area. The second, at the crossing of the trachea, main bronchus, right and left, and aortic arch. So left bronchus and aortic arch when crosses this esophagus, this is the second. And third junction when it enters into the stomach. Now you have to remember the distance from the incisor teeth are important passing instrument of the esophagus. So sometimes it is related to this particular portion. Okay, I think you have not called Dr. Yusuf Shafi to call. Dr. Shafi is calling us. This is cervical part relation. Now this is the relation. This is the esophagus. This is trachea. If you see, posteriorly it is related to vertebral column. Laterally right recurrent and laryngeal nerve. And then on lateral side, this is thyroid gland. So let us do it that what are the relation of cervical part, vertebral column, lobes of the thyroid gland. This is we are talking about the cervical portion. And trachea and the recurrent laryngeal nerve. These are the relation in the cervical part. Thoracic part, when it crosses, thoracic part, you can see this is the thoracic part of the esophagus when it is crossing. This is the arch of aorta and left. The thoracic part is passing downwards to the left, and the level of sternal angle, the aortic arch and the left main bronchus, it is pushing the esophagus to the midline. And here you can see the esophagus is related anteriorly to the trachea, left main bronchus, and this arch of the aorta. This is your anterior. Now anterior relation, trachea, left recurrent laryngeal nerve, principal bronchus and pericardium, they all are lying anterior to the posterior relation in thoracic part, body of thoracic vertebrae, thoracic duct, azygous vein, and left posterior intercostal and descending. This after removing this esophagus, you can see all these structure lying posteriorly. I think this is the end of the lecture. Lateral relation, definitely lungs and pleura on the lateral side. Abdomen, inshallah, we will do when we do the structure abdominal esophagus. When it crosses the diaphragm, it will continue over here. And when it enters, it is related to the muscles of the diaphragm, gastric vessels, and the vagus nerve. Here you can see these are the centimeters from there. 4 centimeters cervical part, thoracic part, 20, and this. This is the X-ray shows the constrictions. You can see the constrictions. Okay, these are the constriction of the esophagus. This is shows the barium. Radiology lecture will give you detail. Arterial supply from below, esophageal arteries. In the above part, inferior thyroid arteries also going to supply the middle third. Thoracic aorta gives the esophageal branches. You can see thoracic aorta give you branches, and lower third, this is the gastric arteries going to supply the lower. So it gets 3 blood supply: above thyroid, middle directly from the aorta, and in the lower part from the gastric arteries it is going. Venous drainage through this system of the inferior thyroid vein, then azygous vein in the middle part, and left gastric vein. Lymphatic drainage you can see in the mediastinal lymph node, upper part into cervical, posterior mediastinal, and the celiac lymph nodes. All 3 portions are going to. Vagus nerve by forming the pharyngeal plexus, esophageal plexus, they are going to supply this. So this is the oral cavity lecture, and I hope Dr. Shafi is waiting for you. I don't know how it is